So cardiovascular health is extremely important, because when you talk about cardiovascular health, basically you are dealing with your heart. That's what we call the cardiac muscles, the cardiac function. Heart is the most important organ in one's body. Okay, the function of the heart is basically to pump blood. So from the blood, this is where you get your oxygen, you get your nutrient, and the blood will have to go to every single cells in the body. So imagine if your pump or your heart does not work well, what will happen to the blood flow or the blood circulation to the rest of the body? Therefore, heart health or the healthiness of your heart is very important. The most common cardiovascular disease that we encounter in the daily practice is, of course, number one is coronary artery disease, or sometimes we call it ischemic heart disease. So basically, this is the problem of the blood vessels that supplies the heart muscle itself. So most of the time, when we refer a term of heart disease, heart problem, heart attack, all these things are normally related to the blood vessels of the heart, or the coronary arteries, what we call in a medical term. And we have to know the fact that for the past many years, the number one killer, not only in Malaysia but globally, is ischemic heart disease, or problem with the blood vessels of your heart, which someone has heart attack because of blocked arteries or blood supply to the heart, and causing them to have dysfunction heart. And second, I would say perhaps in terms of irregular heartbeat or abnormal heart rhythm is very common, especially in young patient, female especially. You tend to get what we call palpitation. Palpitation is basically the sensation of your heart beating, whether it is a fast heartbeat or slow heartbeat. As long as you are aware that your heart is beating, you can feel that your heart is beating, that is called palpitation. Because you and I, we don't feel our heartbeats. Most of the time, we don't feel anything. Unless if you are just relaxing, not doing anything, thinking a little bit deeper, then perhaps you might feel that your heart is pumping. So the sensation of heart beating, especially when you are resting and not doing anything, is termed as palpitation. So I would say this is the second most common problem of heart disease that we see in our daily practice. If you talk about patients who are or person who are at risk of developing heart diseases, we have to look at the patient profile. Okay, as you age, of course, more elderly patients tend to have more likelihood to have heart problem. Not to say that young patients could not get heart problem. There's common trend that we are seeing nowadays, but those days is used to be disease that affects people who are older, tend to be older. Number two is, of course, a patient who has medical conditions. If you do have other comorbidities such as diabetes or abnormal sugar level, if you have high blood pressure or abnormal blood pressure, if you have high cholesterol in your blood test. So these are the high risk group of people who can actually develop heart diseases. So if you are someone with any of the features mentioned, and perhaps an additional risk of being overweight or obese, lack of exercise. So these are some of the other more conventional risk factors that can contribute to increase in heart disease. Alright, so these are things that can be intervened with some lifestyle changes. Right, so if you want to control your sugar intake, then perhaps you have to try to cut down the sugar intake. The most easily done is perhaps cut down your sugar intake in your drinks. And of course, once you are able to tolerate lack of sugar in your drink, then perhaps you would go a little bit further by cutting down sugar in your food, especially your rice portion perhaps. Because if you take too much rice, it is a carbohydrate, but at the end of the day, the end product of carbohydrate will still be sugar, right? So if you can cut down the portion of your rice, it will be good. And then in terms of your blood pressure, other than of course avoiding unnecessary stress, living a very stressful lifestyle, too much of distraction on social media, perhaps you probably want to relax and try to find a time to chill, and cut down salt intake in your food especially. So salt is the most common contributor to elevated blood pressure. What about cholesterol? So if you want to cut down the cholesterol, simply just by controlling your diet, not too much of fried and fatty stuff, especially those deep fried food. Yeah, so all the fast food, unfortunately, most of them are deep fried in nature. So maybe you want to consider cutting that down, or even skip it altogether. Right? So, and I don't have to mention about smoking or even electronic smoking, vaping. These are not excuses for you to continue ingesting all those harmful stuff into your body. Yeah, so I think those are some of the things that you can do perhaps to try to reduce your risk of developing heart diseases. And yes, of course, before I forget, regular exercise. We have to find time to exercise. I think one of the article in the newspaper today also mentioned that our Prime Minister even suggesting that our people should be a bit more active, find time to do exercise. Busy at work is just a very weak excuse to be given. Do you know that most medical conditions, they can be asymptomatic, meaning that you do not have any symptoms, especially in the beginning stage. How do you know that you have an elevated sugar, or even an elevated blood pressure, or even an elevated cholesterol if you don't have any symptoms? And most of the time, we don't have symptoms until it is too late. So therefore, most of the medical conditions, especially the non-communicable disease such as diabetes, high blood pressure and cholesterol, the only way of picking up these conditions is by routine medical checkup. So if you are above the age of 35 or even 40, I would suggest that you go at least for an annual medical checkup, perhaps with a simple blood test, because the condition can be picked up just by simple blood test. Fasting blood can check your sugar. If your fasting sugar is high, you can also look at your lipid profile, your cholesterol if it's high, and simple blood pressure monitoring by your attending doctor can actually detect whether you have high blood pressure. I always tell my patient that if you develop symptoms for high blood pressure, for example, if you do get a bit of headache, then you come for consultation, then you found out that you have high blood pressure, you probably could consider yourself as lucky, because it already gives a sign that your body is not well. Hence, you come forward and discovered that you have elevated blood pressure. But imagine and remember, how frequent have you heard about stories of people just collapse and suddenly fall to death suddenly, just because of sudden surge in blood pressure, causing them to have a massive stroke or even heart attack. Yeah. So once you've got symptoms, that's a definite sign that you have to come for a medical checkup. But remember, most of the time it is asymptomatic. If you look at the National Health Morbidity Survey, the most recent one in 2023, you see up to 80% of patients who are diabetic actually do not know that they are diabetic, particularly the young group patient between 18 to 29. So these are the prime group that we have to really take care, because these are going to be our future leaders in the country. So the health of this youth group of patients is extremely important. 80% of patients who are hypertensive actually do not know, especially those belonging to the age group of 18 to 29 years old. Yeah. So hence, not having symptoms is not an excuse not to come for medical checkup. I guess the moment you hit 30, 35 or even 40, you should at least come for medical checkup at least once in your life.